Hi, I'm Donna Stanley with Endless Mountain Labradors, and today we're going to talk about hip dysplasia. Hip dysplasia is something that is present in a lot of the large breed dogs, and because I breed Labrador Retrievers, we have to be very careful to screen our breeding stock for hip dysplasia as well as elbow dysplasia. Now we're going to put up some samples of x-rays of some good hips and some bad hips. But in general, what you're looking at is a socket with a ball in it, and it should be seated well in that socket. Now placement is really important too in the x-rays you take to look and see if your dog has hip or elbow dysplasia, especially the hips. They need to be aligned right, and so I use a tech that has at least 20 years experience doing this, because you can actually make a dog look dysplastic in an x-ray if you don't have good placement. But basically what you're looking at is the way that ball is seated in there. And so sometimes if it's extreme, of course, it's right out of there. Okay, so there's different levels of hip dysplasia, and the Orthopedic Foundation for Animals has 7 different levels. So when you send a film in, they will grade it. The top, of course, being excellent, and then it would be good, fair, and borderline, so it just goes down from there. So we won't accept anything unless it's a good or an excellent. And so we're looking at something like that. If you see it just coming out a little bit, you might get a fair, it might not even be a pass. But that's basically what they're looking for. Elbow dysplasia, I don't have as much experience in looking at films. We'll put some up for you on the screen just so you can see what they look like. But those I'm not as good at reading or explaining what we're seeing there, but Dr. Keller at the Orthopedic Foundation for Animals looks at a lot of the, well, all day long he looks at those, and they'll also give you a rating on the elbows on your dog. So that's what we do to screen our breeding stock. One of the things that's really important is to make sure that you don't spay or neuter too early before those joints are able to develop properly. So 24 months would be the earliest you'd want to do an early spay or neuter, because that's when the growth plates are done growing. And we had so many years of veterinarians and shelters doing early spays that we actually have a body of evidence right now showing scientifically what that did to the animals long term, and it had a horrible effect on their ability to move, and early arthritis and all kinds of issues like ACL tears and just being more susceptible to joint issues. So a lot of veterinarians, especially your newer veterinarians, are not doing that. A lot of them that are finally being educated and learning all the stuff that us breeders knew for years will not do early spay or neuter either, because they don't feel it's in the best interest of the dog. So you want to also be careful when you get your new puppy that you're not doing a lot of leaping and jumping, or what we would call over exercise, because even slippery stairs can have a repetitive bad effect on those joints. So you want to make sure your dog's not going down slippery stairs a lot, leaping, say for a frisbee or for a ball, especially during those first 2 years, again, so that those joints are able to grow properly and not have any issues long term. So that was just a simple description of hip dysplasia. If you'd like to look into it more, you can go to the site called the Orthopedic Foundation for Animals, and there should be a lot of information there for you too. Thanks for watching this video, and if you enjoyed it, please hit the subscribe button and you'll get all of our latest videos as they come out, because we try to cover things that are current, and as people ask us questions, we do go ahead and answer them on our video blogs. Thank you very much and have a great day.